It was Jonathan Mann, director of the first global program on AIDS in 1987, who put human rights in the center of the global HIV response. This has been a challenge ever since, and is in particular now, since civil society is confronted with shrinking spaces caused by restrictive policies and populism.
The interviews demonstrate what human rights-based approaches are all about and what the HIV and global health movement would lose should we give up our core principles. We need a strong global fund and UNAIDS to secure that this won't happen.
Hello, my name is Anton Basenko. I'm from Ukraine and based in Kiev. We have concentrated epidemic in Ukraine. It's mostly concentrated among people who inject drugs. It's the biggest population. Sex workers, men having sex with men, transgenders and prisoners. The situation with prisons is the most awful. In the reality, prisons are one of the main sources of getting tuberculosis, HIV, viral hepatitis and sexual transmitted infections. Talking simply, human rights is respect, human rights is dignity. If we are talking about the human rights approaches or the human rights programs, just acknowledge that any human, any person have particular rights, including using of particular substance if you are an adult person. I'm talking about people who use drugs and specifically women who use drugs. We are facing with violations from law enforcers and medical staff. Even we are just by the reason of by the fact of being active user, you can be officially refused from the Hep C treatment. When you are coming to some medical facility for the treatment of drug dependence, you automatically must be registered. And this registration is not just a database for the monitoring and evaluation purposes. So this is a registration base, registration which limiting your rights to have particular kinds of work, rights to have driver license, etc. We have some good changes. We have the biggest harm reduction program in the region. We have the biggest substitution therapy program in the region of Eastern Europe, Central Asia, and the procurement of methadone and buprenorphine finally transited under the state budget from Global Fund. But still, at least the medications are there. And now we are started the transition. There we adopted the whole bunch of different legal acts to provide this technical opportunity to contract the NGOs. Also, as I mentioned, Hep C treatment, it started to procure by the state budget. The problem is that it's going not to the right people, but at least government started to pay for that. We finally joined country coordination mechanism. So now people who use drugs, sex workers, men having sex with men, transgender, and prisoners, we are sitting on the same table with the ministers of finance, justice, health, defense, vice prime minister, UN agencies, and all these sectors, and we have the equal voice in the voting. I would also like to remind that support of Global Fund and the Global Fund programs, it's not just saving lives of people, it's changing lives. It's even produces the new lives of people. And 6 months ago, my son was born, healthy, boy. It's not only about funding. Funding is not a magic bullet. It's about people, and not just the numbers, like 32 million already saved people by Global Fund programs, but concrete people who are getting activists, who are just changing their lives to healthy, quality life, and involve these people, hear their expertise, mobilize them, work with them, fund properly, and nobody must be left behind.